And just in the past week, we have been talking about breastfeeding. For babies, I might add. And today I'm joined by MAVIS ASANTE. She's a resident nurse in neonatology. She's a neonatal nurse in training, and she's also a member of a group that she'll be telling us about a bit later. I know her from Mankwanso Government Hospital, but I guess she's in school now. So MAVIS, you're welcome.
Thank you very much,
Yes.
Doctor. And I'm glad to be here.
Yes, it's good to see you after promising to host you on my show for so many times and failing. It's not my fault. I'm sure I'm forgiven, so it's not a big deal.
We'll talk about that later.
So maybe it's in the past week, we've been marking Breastfeeding Week here in Ghana. What's all the noise been about?
We know the health system in Ghana, we are still under an international body, let me say WHO. So August, precisely the first week, is always for the celebration of breastfeeding. So for the past week, other groups in health, I know yesterday Pediatric Society of Ghana also launched something on breastfeeding. So that's all the noise is about. And precisely, we know the benefits of breastfeeding and all that. We wouldn't want to leave anybody behind, any baby behind, because we know once you invest in breastfeeding, you invest in the future of the newborns who are going to be our future leaders. So that's what it is about. So this August, the first week throughout, it's all about breastfeeding.
Okay, so the whole of August is dedicated to breastfeeding, and
Yes.
we're encouraging people to breastfeed. And yes, I mean, there's been a lot of activity. I think this year more than last, there's been a lot of activity on raising awareness when it comes to breastfeeding. I don't know whether there are any numbers, or have people really sort of shied away from breastfeeding? Are people breastfeeding like they used to, or it has gone down?
I think yesterday at the lunch, I got to know that some studies conducted in Greater Accra and also Ahafo region shows that now, not breastfeeding precisely, but exclusive breastfeeding is sort of going down, but we are doing about 41%. So we would want to move higher.
But what's the difference anyway? Breastfeeding and exclusive breastfeeding. I thought they were all the same thing.
Oh, no. So, we expect that the babies are breastfed right from birth to infancy. That's about the 0 to 2 years of age. But with exclusive breastfeeding, we expect that within the first 6 months of birth, baby receives nothing aside breast milk. Whether water, what we call gripe water, these supplements and all that, baby receives nothing. Even for cleaning your baby's mouth and tongue, we expect that you use the same breast milk to clean your baby's tongue. So it's exclusive.
So that one is like nothing else but breast.
Yes, nothing else
Ooh.
but the breast milk. Yeah.
But I mean, that sounds like a difficult thing to do.
Oh, it's not.
It sounds like,
It's not difficult. so weighing the benefits, it's not difficult, because sometimes you would think that these products on the market, the formulas, they are going to, let's say, provide your baby with more satiety or more hydration. But we know that breast milk has, it's about 50% fat. So it has all the calories your baby needs. And it's about 87% water. So all the hydration that you need, it is there. It has the living cells, it has the stem cells, carbohydrates, proteins. And because it's sort of made by the body, it is well absorbed. It's in its bare state. It is exactly what your baby needs. Exactly what your baby needs. Nothing more.
Nothing more.
Nothing more.
This is 107.9 Orange FM, and this morning I'm here with a neonatal nurse. She's talking to us about breastfeeding and everything else in between, and how essential breast milk is. And I know quite a lot of people try their best. I think people really struggle to breastfeed exclusively. There are issues, and we'll come to that. But for somebody who, let's assume, has never or doesn't know what the breasts are, what really are these things called the breast?
Oh, we know the breasts they are paired mammary glands, and they are on the chest, and they have glandular tissues. In fact, their main duty is for milk production.
For children.
Yes.
Please emphasize for children.
Yeah, for children.
Thank you.
So looking at the size, the shape, it has to do with the adipose tissue. It's not mainly about the amount of milk it's going to produce. The size has to do with the adipose tissues. Also, they are supported by connective tissues.
Okay.
So that's it about the breast. It also has some lymph nodes, blood supply, influence of hormones. That's why it's also very sensitive, especially the nipple. But today we are here to talk about breastfeeding. Yes, nothing more. Breastfeeding for our babies.
For our babies.
And our infants, because we want to invest in we want to invest in the future of Ghana and the whole world. So that's what we are talking. Nothing more. Please, your mind should be here. We are talking about breastfeeding for babies.
We were talking about breastfeeding for babies, and in August we were highlighting the importance of breastfeeding when it comes to children, and putting all of these things into perspective. Like Mavis said earlier, some studies have gone on, and we have realized that the numbers have gone down. The number of people who are actively, consciously breastfeeding their babies exclusively has gone down. And I don't know, for a lot of people, I think people struggle because, like, people who work, who are in formalized work, you have to, your leave is over and you have to go back. So it's a bit difficult for people to breastfeed. And so someone has sent a message saying that breastfeeding is probably one of the most difficult things to do, especially when you're new to breastfeeding. Like first time mom, even holding the baby is a problem on its own. So it makes, I think, people just get tired of it. Like, they just don't want to breastfeed. So don't worry, new mother, we will show you. You actually have a dummy here, so we'll actually demonstrate to you and show you how attachment should be done. But if you're just tuning in, this is 107.9 Orange FM, and this morning we're talking about breastfeeding and the benefits of breastfeeding here, especially in our environment. But maybe let me ask, does the size of the breast or the shape of one's breast have any influence on one's ability to breastfeed?
Oh, not at all. Like I mentioned earlier, the size of the breast has to deal with genetics and the adipose tissue. So a big breast can produce enough milk. A small breast can also do same. Breast milk has to do with demand and supply.
So the size doesn't matter.
The size doesn't matter. The more you are attaching your baby to breasts, the frequency of feeding, the rooming in and all that, that helps with the breast milk supply. So it's not about the size. I think last month I was on the ward at Sontreso Hospital, and we had this new mother, a teenage mother. She was producing milk. In fact, we were even joking about it, like we have to send some to UGMC since they now have
a milk, a
so
breast
the
milk bank.
Size does not really matter. The size has issues with position and attachment here. But for milk production, no.
Okay.
The size does not matter.
Okay.
Yeah, it's genetics. So
Okay.
if I am a big lady, you don't expect me to have the breast of, let's say, a small girl.
Okay.
So it has to deal with the adipose tissue.
The adipose tissue. So it's not size. When it comes to breastfeeding, size doesn't matter.
No.
It's more about your genetic makeup and what the amount of adipose tissue that you have. That makes it, because people usually say, oh, I'm not breastfeeding because I think that my breasts are small. Okay, all right. Then, there's a lot of, I think, traditional myth. I don't know how it came about, but there are a lot of conversations around breastfeeding. People are not comfortable with feeding babies immediately they are born. It's now that people feel like, the next for semi. But most people are very uncomfortable feeding the babies as soon as they are born because there's this perception that the milk that comes immediately is unclean. Does that hold any water?
Oh, no. So, the first milk that comes, it's called the colostrum. And if you can see, it's mainly sort of very yellow or darker than the milk that comes later. And that's rich. It has a lot of fat. It's easily digestible. It can be well absorbed. And in fact, because of how it is made, it gives the baby also free bowel. It also has that micronutrients that is supposed to protect the baby from all other infections and all that in the first week, because I know the colostrum is about the first 3 days. So don't spoil your colostrum away. Don't give it to your husband. Your baby needs it. Once you are seeing breast milk, please, if you've delivered, that breast milk is for your baby, nobody else. And this breast milk is going into the baby's mouth. It is not going on the baby's eyes to treat any other conditions.
Oh.
Yeah.
Okay.
So there's also something like that, since we are talking about culture.
Yeah.
Sometimes when the baby has jaundice, that's the yellowish discoloration of the eyes and the skin, they tend to put breast milk on the baby's eyes as treatment. But no, you are causing more harm than good. Take your baby to the hospital. Breast milk is for the mouth.
It's not. We don't put it in the eyes.
Not at all. Once you see breast milk, remember your baby's mouth. Put it there.
Okay. So we do not use breast milk for treating conditions of the eye in babies.
Yes.
Okay. Now, I'm sure you're aware that there are some people who have different nipple shapes. Some are flat, some protrude, some retract, some are inside. How easy is it for people to breastfeed, or for women to breastfeed, depending on their nipple shape?
So I would say it's challenging. Yeah, it's challenging. But we should remember that the baby does not latch on the nipple. The baby latches on the areola.
Which one is that? Yeah,
so previously we know our nurses used to pull the nipples with syringe. We used to cut.
You people do things so.
Where the syringe is, then we place the plunger at the opposite end, then the smooth end we use to pull the nipple. But now it's not being done because people are doing evidence-based practices that are also helping a lot. So once the baby is latching on the areola, you have to reshape your areola. If you have inverted nipple or flat nipple, you are supposed to support your areola. So all these will be found out during your antenatal examinations. So right from there, your midwife or your obstetrician or your nurse will take you through all these. Okay. So don't put it in your mind that my breast is too small, my nipple is too large, or too small, my breast is everted. You are going to be assisted by your midwife to reshape
Okay.
So it's sort of placing your forefingers beneath your breasts, exposing your areola. Then your thumb will be, let's say, the anterior of your areola. Then you sort of push it back. Yeah, so that the nipple is coming out. You know, it wouldn't come out fully.
Yeah.
But once you hold it that way, you sort of reshape your areola to fit into your baby's mouth.
So the areola is the black part around the nipple.
Yes, the areola is the black part. And we know that in pregnancy, you can see that that area becomes darkened and it's more pronounced. So that's where you can get lots of the milk. It's not the nipple. Once your baby is latching on the nipple, you're going to get sore breast, sore nipple, cracked nipple. Sometimes your breast can even be engorged because you are not positioning well.
Oh, okay. So the baby is not supposed to be sucking the nipple.
Not at all.
It's supposed to be the entire black thing.
Yes. Most of it.
Most of it.
Most of the black thing.
Okay.
So we can talk about the attachments. So with the attachment, we have to know that your baby's chin should be touching your breasts.
Your baby's chin.
Yes.
Okay, you brought a mannequin.
Yeah,
so
I brought a mannequin.
You'd have to. So if you're listening, it will be a bit difficult to picture. But if you're watching us on Orange 107.9 FM, we're on YouTube. We're on YouTube here. You will see the video that we're showing, and MAVIS is demonstrating how the attachment should be, how the attachment should be. So if you go on our YouTube now, you will see that it's very clear, it's very brilliant there, and you can see how she's demonstrating how the baby should be attached, and she's using a mannequin. So no, Alessa, the way you're showing it, that's not how it's supposed to be done. You during your time, you need to be coached in breastfeeding. So maybe it's sure.
So with a breast milk position and attachment, we should realize that how I am seated is totally wrong. Once you want to breastfeed, if you are home, a nursing mother, make sure that you are sitting in a chair with backrests.
Okay.
I mean, plastic chair. Yeah.
Okay.
That one.
Not kitchen stool.
You can use kitchen stool, but with kitchen stool, make sure you get, let's say, a wall.
Okay.
So you put closer to the wall, then your back is resting on the wall. If you are seated on your bed, you can also go to the wall side. You're on your bed, but your back is against the wall.
Okay.
And you also have to make sure that your baby is in line.
It's in line.
It's in line. Like as you hold your baby, the body should be in line. And lest I forget, we should try and wash our hands.
Okay.
In as much as we are providing breast milk for our babies, we are breastfeeding them, we should not rather be introducing some things that will cause more harm.
Okay. So you should wash your hands. Okay.
Make sure your brassiere is clean. You are not going to wear one brassiere throughout the whole day. At least twice a day, or if even once, but you are cleaning the excess that's on the breast. You are bathing twice and all that. That's also good for you. So your baby has to be in line, like I'm holding my baby. The hair should be in the crook of your arm. So here, the opposite of your elbow, if I should say, those listening. So my baby's head rests there. Then my baby's bottom is supported by my palm.
Okay.
Then my baby's abdomen should touch my abdomen. So it's sort of a bonding process.
Okay.
I'm communicating with my baby. It's not where you are breastfeeding your baby and you are still talking to the other kids. You are talking to your husband and all that. Sometimes your breast might be covering your baby's nostrils. So once I get the required position, then I go to the attachment. With the attachment, my baby's chin should touch my breast. Then I should see more areola at the top part of my breast than below as I place my breast, let me say, in my baby's mouth. So baby is not going to just latch on the nipple. The areola, much of it is entering my baby's mouth. And the lower lip, it should be everted. I mean, it should be turned outward. It shouldn't be inside.
Okay.
Yeah. So that's it. The mouth should be wide open. I shouldn't hear any funny sounds. When you are very thirsty, you get to your fridge, you take cold water. We hear that that sound. Yeah, that's what you are supposed to hear. Okay. Not the feel. Once your baby is doing the feel, your baby is just trapping in air. Your baby can aspirate and all the other things we don't want. So try and attach your
like
baby.
You should try and hold the baby closer to you.
Hold your baby. It is your baby. Hold your baby. So most of the issues we have on the ward is that the mothers they have, let me say, their own ways that they would want to breastfeed. We always tell them don't do scissors and all that, but we can support them with their own special way they want to breastfeed, because some types of breasts, like we were talking about, may not support this type. So this position is called the cradle position, or the cradle hold. Yeah. So we have another one called the cross cradle. So with the cross cradle, how I'm holding my baby, I just have to switch with the opposite arm. Then this the opposite arm is then supporting my baby. Okay. We also have one called the football. With the football. Yeah. Hey. So with the football, I mean